Thank you so much for being with us. Today is the second in our webinar series on mandatory reporting. My name is Morgan, and I'm a community research liaison with the University Center for Excellence in Developmental Disabilities at the Oregon Health and Science University. The Oregon Health and Science University sits on the occupied land of the Multnomah, Cathlamet, Clackamas, Tumwater, Wallala bands of the Chinook, the Tualatin, Kalapuya, Molalla, Wasco, and many indigenous nations of the Willamette Valley and Columbia River Plateau. Before we introduce our presenters today, let's go over a few details about this webinar. American Sign Language interpretation is available for today's webinar. Thank you, Jessica and Amber, for being here today. Spanish language interpretation is also available. Thank you, Rosie and Andre, for being here today. If you click the icon that looks like a globe, you can choose to listen to this webinar in Spanish. You can also turn on closed captioning by clicking the CC icon. If you have a question for any of our presenters, you can type it in the Q&A box. And at a certain point, we'll also invite you to enter your questions or your responses to some of the discussions in the chat as well. And now I'll turn it over to our presenters and they can introduce themselves.
Well, I can start. My name is Dallas Tully. I use she, her pronouns, and I am the Training and Investigations Manager for the Office of Training, Investigations, and Safety. OTIS is what you'll hear us refer to our organization as. And I will pass it over to Carol.
Carol Schrader. I work at the Victim Rights Law Center. I'm an attorney there. We provide representation to survivors of sexual assault, and we provide national and Oregon-specific technical assistance on all sorts of issues, including mandatory reporting, privacy, and confidentiality. And with that, I will turn things over to Sam.
Hello, everyone. My name is Sam Wilmart. My pronouns are she, her, and I am a program specialist and abuse investigator with Multnomah County's Intellectual and Developmental Disability Services. And we arrange for protective services and conduct abuse investigations for adults in Multnomah County with intellectual and developmental disabilities. And I will pass it over to Krista.
Good afternoon. I'm Krista Duvall. I also work for the Office of Training Investigations and Safety, or OTIS. I'm an investigations unit manager for child abuse investigations teams, and I have also worked with our adult investigations as well. I will turn that over to Kate.
Hello, everyone. I'm Kate Hildebrandt. I use she, her pronouns. I'm a civil rights and Title IX specialist at the Oregon Department of Education, and I provide training and technical assistance to K-12 schools in Oregon on state and federal civil rights law.
All right, I think we introduced our entire panel. Our learning objectives and roadmap for today. The goals of this training will be to describe mandatory reporting basics, a goal to understand the investigation process, and to implement best practices for mandatory reporting. And then I think we've got a couple participant polls that should be popping up shortly. If you could take some time and fill those out, they are going to help give us a little bit more information as to who we have here today, what roles you fill, and just general familiarity and experience with mandatory reporting. Oh, looks like the poll might have popped up very briefly and disappeared prior to folks being able to fill it out.
I still see it on my screen for what it's worth. Are you not seeing it?
It looks like it just popped up again for me.
Okay.
For folks who chimed in on the chat, did it pop back up? Oh, great. Thank you. So we'll take another minute or so to give you an opportunity and some time to fill that out.
Thanks, Sam. It looks like everyone's completed it.
Perfect. Thank you. All right. We are going to move on and actually propose actually, let's view. It looks like a majority of folks answered that they felt they knew Oregon's mandatory reporting laws very well or well. So it looks like quite a few of the folks on our call today are feeling pretty confident and have some experience with making reports and mandatory reporting. Thank you, everyone, for participating. So Carol, if you're able to shift to the next slide. So we are going to actually start off with a scenario, and I'm going to read through it and invite folks, if you'd like to participate, to write in the chat some ideas as to how you might respond, ideas for potential follow-up for this situation. So scenario 1, you overhear a conversation between two 18-year-old students, one of whom you know has a diagnosis of intellectual disability and receives intellectual and developmental disability services from the local community developmental disability program. The student who receives DD services tells the other student that her stepfather groped her buttocks over the weekend. She states that he's done it in the past and continues to do so despite her asking him to stop. So we'll give folks a few seconds to put in some thoughts into the chat. And then afterwards, I'm going to give just a general overview, not an exact specific step by step for what all this situation might entail, but some ideas for follow-up questions and some additional considerations that we might have. But for now, we'd love to hear from you.
We have we have a couple of comments coming in. Isn't she a protected class? I would report it. And there come attendee says report. I would report it and give details of what I know about her hygiene care needs, whether she tends to understand time, etc.
Yes, it seems like so far out of our responses, and feel free to add in a few more into the chat, that uh, based on the information that we do have from this scenario, that this is something that would fall within the mandatory reporting requirement. We have an adult who has a diagnosis of intellectual disability, and so that is identified as a vulnerable person, and we would need to make a mandatory abuse report. It looks
A
like,
few other, we have a few other comments if you'd like me to read them off.
yes, please.
Me. Let me see here. We have, I would need more information from the student by asking non-leading and open-ended questions. And that constitutes a mandatory report. It's important to be as trauma-informed as possible and to try to prioritize the student's agency. I would talk to her and let her know I have to report it and give her an opportunity to ask questions and offer additional support. And we have, I would also follow up to see if it's been reported before and if there was follow-up.
You all have some great ideas and are making my abuse investigator heart. Just very happy with some of those considerations in there. So some of those themes need a little more information, as well as the non-leading and open-ended questions is very important, which can be really tricky sometimes because when an investigator comes in, we want to maintain the integrity of the investigative process, and having multiple people asking multiple questions can sometimes make that challenging and not be as trauma informed as well too. So I also saw some pieces about the reporter's own familiarity with the student and their needs and preferences. That's going to be really helpful information as well when making a report. So I'm going to go over a few other kind of questions that might be considered or follow up. Um, so I work for a community developmental disability program, which is the involved program in this scenario. And most of the time, we are going to want to try and collaborate with existing supports because there is the reporting piece. And we also want to make sure that if we can connect with those existing supports, maybe do some safety planning to try and prevent further occurrence of abuse from happening. So, if the individual has a case manager, which in this case they would if they're receiving services from the local community developmental disability program, our team would connect with the case manager, try and find out a little bit more, and see if we can have them arrange for additional safety planning. Some other questions that you might be asked or could be a part of that follow up is finding out if there's anybody else in the home. Are there other children who might be in the home who could also be experiencing this? That could help inform if an additional program needs to be notified of the concern. Um, we also may want to work with the reporter. So if you're working at a school, to see if we can coordinate having an investigator come out to the school to meet with the student. And the school setting can be a more neutral location too if some of the safety concerns are occurring at the student's home. We also want to find out if she has any additional supports that are either paid or natural supports like family, friends who could provide additional advocacy. And then we're also looking at the potential for filing a police report and seeking a protective order depending on the situation, and possibly preventing the accused person from having further contact with the student. So, and that could be done by a case manager, an investigator. It could be done by the reporter. It's often a very collaborative approach, and we try and figure out what's best for the situation and the alleged victim in that circumstance. All right. Thank you all so much for providing your ideas and for follow-up and questions. And we're going to go over some additional scenarios later in the slideshow. And provide you with some more information about mandatory reporting and what we do.
So I'm Carol, and I use she, her pronouns. And I am an attorney, but I'm not your attorney. So I just want to say that at the beginning to highlight that I'm not giving legal advice. Though I think I might be giving some fresh perspectives. I really appreciate that we have a small group, and I'm going to walk through my legal analysis. As I mentioned earlier, I focus on serving survivors of sexual assault and other gender-based violence. And for me, a priority is protecting people's privacy. So I think when I think about mandatory reporting, I think about how we have mandatory reporting because we say there are certain people in our community who need our help. And we want to help if they're in a situation where they can't help themselves. So child abuse, adult abuse, elder abuse. And so that's the pro. There is a con, though, that some people won't tell us things if they know we're a mandatory reporter. And in my lane of work, there's funding from the Office on Violence Against Women, which you don't have. The Violence Against Women Act requires people who receive that funding not to share any personally identifying information unless there's a statutory mandate. So we look really deep and hard at the statutes, which I realize that as an attorney, I love to do, but others may not be as interested. So please use the chat if I say something you don't understand or you disagree with or you want to talk more about. I invite that conversation. I'm really pleased with the size of the group from that perspective. I think we have the space to have some good conversation. I thought too, the first session on mandatory reporting, Eli gave some great best practices advice, and I'm not going to focus on that so much, which may seem cold. Don't mean to be, but just I'm focusing on the legal piece as my piece. And yeah, I want to make things accessible. So when I think about the scenario that we just went through, I am looking at 5 questions that we're going to get to, and I'm looking at the mandatory reporting law in Oregon. So let's start with that. So there's 6 types of mandatory reporting, and I'm not talking about duties to protect or warn that mental health practitioners may also have. I'm not including that on this list. But I'm looking at thinking about abuse or sexual conduct by school employees or contractors, the child abuse mandatory reporting law, the abuse of an adult which is abuse of adults with certain specific disabilities, abuse of elders, serious non-accidental injury, and reportable diseases, sexually transmitted infections. And I have the statutes and regs here if you want to look at them more. And I think the top 3 are the 3 that are relevant to today's conversation. I'm not going to be addressing the last 3 on this list. And then I think so often we get to the assessment of I'm on the list of public or private officials. So for those of you who are school employees, which I assume most, if not all of you are, school employees are on that list. And I think so often like, oh, I'm a school employee, I'm a mandatory reporter, and that becomes the end of our analysis. But I think there are other questions we need to consider. And that is the victim someone whose abuse or injury must be reported? Has the victim experienced abuse or injury as defined by statute? And I want to pause here and say, as I work through these questions, I go back and forth about where best to bring up we're looking for a reasonable cause to believe. It's often framed as a suspicion. I'm going to say more about that later, but we need to, the standard in the law is there a reasonable cause to believe this abuse or injury has happened to this someone who's protected by the statute? And then are you exempt from reporting? And lastly, what must be reported and to whom? So we're going to go through each of these questions in turn. So first of all, are you a mandatory reporter? So this is who's a public or private official for the child abuse reporting law, and it's the same for the abuse sexual contact law, and it includes school employees as well as the other people who are on this list. But I think it's most relevant to highlight the school employees piece. What's interesting about the adult abuse and why I might have had a different answer to the question, the scenario that Samantha posed for us, that Sam posed for us, is that school employees aren't on the list of public or private officials who are required to report adult abuse. There are others who are on that list who could be at schools, like nurses, physical therapists, and others, but school employees aren't on that list of public or private officials, which I think leads to some interesting possibilities. And I'll touch on those. Well, I'll just say now that in that scenario, I think there's mandatory reporting and then there's permissive reporting. In Oregon, anyone can report. Anyone's allowed to, but not everyone is required to. And so if you're not required to report someone's abuse, it gives you some latitude. I think I can understand there may be reasonable disagreement on this. On whether or not you're going to report in certain situations, which I think you need to be transparent about beforehand. I think reporting should never be a surprise for anyone. It should never be a surprise to someone that you're reporting when you're talking about your role in your work with them in a school. It's something that should be clear. If you tell me X, I'm going to need to tell someone else, however you frame that. But I think that there could be some latitude with this particular scenario that could be good for the person who's talking or that you're hearing about the abuse from. The next question is this someone whose abuse or injury you must report? So in thinking about that, first thinking about the sexual conduct and abuse in schools mandatory reporting, a student means any person who is in pre-kindergarten through 12th grade or 21 years old or younger receiving education services from a provider not a post-secondary school or previously known as a student and left the school or graduated within 90 days prior to sexual conduct. I would think in our initial scenario, this person who was groped is a student. A child, when we look at child abuse mandatory reporting, means an unmarried person who is under 18 years of age or is a child in care as defined in the statute. I'm not going to read the statutes, but they're here. A child in care is a person under 21 years old residing in or receiving care services from a child caring agency or Proctor foster home subject to these laws, certified foster home, or a developmental disabilities residential facility. However, a child in care does not include a person who's under 21 years old who resides in an entity in any of these entities when the care provided is in the home of the child by the child's parents, which I thought seemed likely in the scenario we had. So I thought that pulled that person, that 18-year-old out, even though they're under 21, because of this exception. Again, doing the legal analysis here, which may not be the analysis that would be your go-to, but I think it's interesting and important for you to be aware of in your work. When we look at the adult statute, mandatory reporting statute, an adult is a person who's greater than or equal to 18. So this would apply. That's my typo there. That greater than sign should be a greater than or equal to sign. An adult is a person with a developmental disability currently receiving services or previously determined eligible for services from community program or facility, or with severe and persistent mental illness, or receiving services for substance abuse or mental illness. I think that part A applies in this scenario. But keep in mind, I still have a thought about, in my analysis, about whether or not
Carol?
employee would be a mandatory reporter. Yes, Morgan.
I think we had someone who raised their hand.
Okay.
John, was that you?
Yes, yes, it was. I appreciate your time and effort, and hopefully no video. I apologize for not the personal touch, but my trouble is, and I'm trying not to make this every single slide or whatnot, but I came from a non-disability community before I took services at 25, age 25 plus. And the thing that really makes it difficult when you volunteered, for children to other aspects on the non-disability community, there are different provisions and different culture and different ways of how you categorize mandatory reporting or not. When I came into this community, language like this, when they say a child, DHS says a child is 22 or younger with agency with choice and other concepts, and then ODDS says a child is 21 and younger, with IDD. It is very confusing to categorize when you try to go through the steps. And so when I see language like this, how can I better perceive and understand mandatory reporting, it might be in future slides, but just right here is a great example on where the confusion is, where the adult is 18, but one with IDD, it might be 21. And so I would love some help in trying to categorize mandatory reporting, knowing that these people with disabilities have different meanings, different culture, were raised by guardians and parents, versus say helping those teenagers on the non-disability side or young adults, where it's just a different categorization. Thank you, and I apologize for putting it here. Maybe you have more future information, but right here is a great point where 21, 18, free determined life, non-free determined life, etc. Thank you. I appreciate your time.
I'm glad to take a first go at this. John, first, thank you for your question. I welcome yours and anyone's question because I think it's so important to talk through. And I think you've raised a really good point in that I'm just presenting the laws and it is a lot. And I think what would be super useful is if there were a chart that would line them up or, have a flow chart or something. So yes, that with more time, I would love to have a flow chart. That would be
Maybe
really
just a note for OHSU, but it would help. It would help because when I go to my non-disabled friends in, volunteer land and all that stuff, we categorize different scenarios differently than those with IDD. I feel like we categorize. And then when I'm in the IDD community, it is a whole different scenarios of and how we perceive abuse and not abuse. And when we speak out, we get behavior contracts, we get certain other exclusion and other cultural things that are beyond this conversation. So I'm just trying to figure out how to categorize while navigating those with intellectual and developmental disabilities. While those two slides definitely show a story without fault in ways of how we navigate this conversation. Thank you, and I hope I could hear more as I always try to stand down for the rest of the seminar. Thank you.
Or please don't feel the need to stand down. I understand if you do, but I
All right.
encourage you to keep asking questions and engage. Yeah, I think so. What I'm presenting is the law, and then there's literature like Department of Education or DHS has literature, and that gets another layer. And then there's how we actually talk about things in real life, for lack of a better word. So this is what I'm hoping this will do is show the baseline. Again, I'm a lawyer, so I come at it from like, let's start with the law and then go from there. But what you're raising is.
How about this? For
Okay.
me and my cultural bias in trying to learn this field the last 4 years, is a child 21 or over with IDD, adult 21 or older with IDD, is that considered a child, or are we supposed to consider adult laws, or are we supposed to consider children's laws?
Yeah, if it's someone over 21 years of age, you could, I think the law that would probably apply would be this adult law.
Okay.
Because
And that
you're
makes
getting
sense
out
in a
of
way
the
it's
child
different.
in care situation. You're in
All right.
adult, so anyone.
I apologize to those on call, but it has been very confusing, definitely, when an 18-year-old is an 18-year-old in the outside world while I volunteer, on a non-disability community, and then, 21 or younger to other experiences in life. It's very, I appreciate your time and efforts. Thank you.
Of course. Okay. So then we've got this other category. Is this someone whose abuse or conduct must be reported? So let's start with the school-based student law, abuse, sexual conduct. A school employee shall immediately submit a report if they have reasonable cause to believe, that's that language in the statute, reasonable cause to believe, that a student is subjected to abuse by another employee, contractor, agent, volunteer, a student is subjected to sexual conduct by another employee, contractor, agent, or volunteer, or another employee, contractor, agent, or volunteer has engaged in sexual conduct. That's what needs to be reported under that statute, the first of the three statutes. With child abuse, the standard is any mandatory reporter having reasonable cause to believe. I just want to emphasize this: reasonable cause to believe is the same across all three. All three use that language. to believe that any child with whom the official comes in contact has suffered abuse, or that any person with whom the reporter comes in contact has abused a child, shall immediately report or cause a report to be made. One thing I want to highlight before moving on to the next question here is this comes in contact language. So it's if you overhear something, but you haven't been in contact with the child you're overhearing the information about, or the person who's caused the harm, that isn't arguably not coming into contact. So just want to flag that coming into contact language. And then the last of the big questions before I move out of the really deep stuff is, has the person experienced abuse, neglect, or injury? And by deep, I mean dense. I think the whole thing is pretty deep from a philosophical perspective, but this language is dense. I acknowledge that it is, and so appreciate your engagement with it.
Oh,
So this, go ahead.
pardon me, Carol. We have a question in the chat. How does that relate to the first scenario, the coming into contact question?
Well, if I were more adept with my slides, I would go back to it. But this is, you overhear a conversation between two 18-year-old students, one of whom you know has a diagnosis of intellectual disability and receives IDD services from the local CDDP. So I think it depends, which is of course the classic lawyer answer, but I think it depends. I assumed, and I think in a scenario, a lot of assumptions can be made, that you know the student. But if you don't, then it does become an issue. You don't know the student or the stepfather, then arguably you haven't come into contact with either the person harmed or the person causing the harm. But it sounds like you have you in this scenario have some contacts with that student, and I assumed that you were. But it's a great question. I really appreciate it. It's thoughtful. Does anyone on the panel see this differently? Want to weigh in? Okay. All right. 1 second. So abuse has the meaning in the child abuse mandatory reporting statute, which we're going to look at in just a second. And sexual conduct is conduct or communications that are sexual advances or requests for favors to or of a student, sexual in nature and unreasonably interfere with educational performance or creating intimidating a hostile educational environment. With Kate, Kate covered the Title IX sexual conduct related stuff in the first session, and this harkens back to that within the Oregon statute, and there are other statutes that mirror provisions of Title IX as well. The child abuse has this list of things that are abuse. Going with the first scenario, I made the assumption it could be argued, given Oregon case law, you might need to ask some more questions, that groping was sexual abuse. I think that is the likely and reasonable interpretation, especially if we're looking at reasonable cause to believe. But these are the things that needs to be on this list in order to be abuse under the child abuse statute, which, as we saw earlier, is the student and sexual conduct statute refers back to this as well. I think I want to just highlight, in addition to the sexual abuse part, that the focus is on physical injury. So it's not, there needs to be this injury with some of this. You can look at the statute for this, the 419B.005. Adult abuse has a different list. It also has sexual abuse on it, which is why I think it applies to our starting scenario, but it doesn't have all the same things on it. So it's good for you to be familiar with what's on that adult abuse list as well. And then I'm going to quickly go through these next questions because I don't think they apply to most of you, but I think it's good information for you to have. Are you exempt from reporting? Probably not. But I wanted to let you know that psychiatrists, psychologists, members of the clergy, attorneys, or guardians ad litem are not required to report if the information is privileged. So there are certain legal privileges that exempt people from reporting some of the statutes. And I want to flag at this time at a point that Eli made very nicely during the first session, and that is, given this, that some people aren't going to tell mandatory reporters certain things because they don't want a report to be made. Keep in mind that victim advocates are not public or private officials under any of the mandatory reporting laws we're talking about. And so the extent to which someone might not want to tell, unless they know it can be kept private, keep in mind victim advocates may be a resource in those situations. And then the last question is, what must be reported to whom? So the
Carol?
reports, oh, go ahead.
No, I was just going to say, I think that there is some data available that does indicate that if there's an advocate involved, the likelihood that something actually gets reported can go up, even though they are not mandatory reporters. So just providing that safety and that sense of psychological and emotional safety around it's your choice on whether or not you do this, I think really leads to an increase in reports coming through.
Yeah, that's a great point. And I think too, how someone may just want to know what's going to happen if I tell, and they don't want to necessarily tell, but they just want to know if we, you, I, anyone makes this report, what's going to happen. And you can't get that information without triggering the report if you're talking with a reporter. So yeah, I really appreciate that point. Thank you for making it.
Thank you. And we have another question in the chat.
Mhm.
I'll read it out. Would you say that, quote, mental cruelty includes intentional and constant misgendering / dead naming of a transgender individual? I believe that this does constitute abuse, and notice that there is an even split among people in my field as to how they view it.
Yeah, here's my initial take on that. It was something that I think would warrant some research to know if there's more going on in Oregon law. The harm, and I'm just going to quickly grab my statute book. The harm is any mental injury caused by cruelty. So someone would need to demonstrate, or as far as from a reporting perspective, you're just looking at, is there reasonable cause to believe that someone has experienced mental injury caused by cruelty, which could be constant misgendering, dead naming of a transgender person. In this case, it would need to be a child. But the standard is that mental injury. So there would probably need, so if you're a mental health provider, this is easier. Those of us who aren't mental health providers would just need to have a reasonable cause to believe that someone has experienced mental injury. So I can't give that yes, no answer you may want, but this is where I would look. I would think that this could fall within that mental injury caused by cruelty category.
Carol, are you okay if I add something to that as well?
Of course, please.
So, again, I'm primarily like the scope of my programs and investigations is adults, but when we do have some definitions as well, where we're kind of focusing on that harm piece and looking at emotional harm too, and what can be really helpful in terms of information if you are familiar with the individual is maybe what is typical for them in terms of their affect, maybe, the skills or some of the like limitations they have around emotional dysregulation. And if there's an observable difference too, you may not have that information, but it can be really helpful to for us who are we're coming in, we almost always never know the person, and see, is there a difference from what is typical for this person following the statements that were made.
I think also just from a screening perspective, as somebody who is just taking the information in, if you do have that something that can speak a little bit to how the child was impacted by that, if they have specific statements around how that makes them feel, I think all of that information is very helpful when a call does get made to, whether it's the child abuse hotline or whoever's screening that call, because that's one of the elements they likely will want to capture is what is the impact to the child. And Sam, your examples of, baseline behavior or what's kind of typical for this individual and how are they um, uh, demonstrating some level of impact from that scenario, I think would be really important also.
So if you have reasonable cause to believe that someone who's in the categories that you need to report and you're a mandatory reporter, what the statute requires the report to contain, if known, and I'm going to pause there, there's not an expectation that you're going to investigate or you're going to need to ask if you don't know it, you don't know it. So it's just if you know this stuff, then you provide this stuff when you make the report. Um, and this is for child abuse mandatory reporting. It's slightly different for adult abuse. With the school abuse and sexual conduct, it comes through the child abuse lens. For all of them, the report needs to go to DHS or a law enforcement agency in the county where the person making the report is at the time of contact. And then the school, in addition to that, needs to go to the school's designated licensed administrator. I want to flag that if you're working with someone to make a report, given that this is all that's required, you could report more, but I think it could be worth having a conversation with someone to say, this is what I need to report. Do you want us to say more about what's going on with your story? Do you want us to add information? Or if there's something that someone's like, I don't want them to know this and it's not on the list, then you can say, well, I don't have to tell them that. So just to know that I think it can help to know that there are parameters, which is, I'm not saying to be obstructionist, but to give control to the person who's experienced the harm, to give some control there. So with that, we have another scenario.
All right. Okay. Um, I just wanted to add to Carol that last point. I think that is so important too, is in a situation where often the person feels like they have no control, um, just even inviting them to provide like a preference or is there any other information you feel like would be helpful for the investigator or the screener to know? And providing that invitation and having it be a choice, it can go a long way. Um, so with that, I will read our second scenario. It's going to follow a very similar structure to the first scenario that we did. Um, a 19-year-old student comes into class with a black eye. You know this student has a diagnosis of intellectual disability and receives IDD services from the local Community Developmental Disability Program. When you pull the student aside and ask him about his injury, he tells you he slipped and fell. He has no other physical injuries. He asks you not to bring it up to his adult foster care provider before quickly changing the subject. So, if you have thoughts, ideas about follow up or some of the response um, that you would do in this situation, please take a few moments to type it into the chat and Morgan will read through some of those responses and then we'll go into some additional questions and considerations. All right. Oh, perfect. See, I knew if I
Oh.
started to talk, we would get some responses in the chat.
Oh, right. So I will begin reading these. So we have, I would be inclined to report it so it can at least be looked into. If he is in a foster home, there may be, be others who may also need help. And I would ask some additional follow-up questions about his safety. Does he feel safe at home, at school? Where did he fall? What is his concern about his provider finding out? And I would report this after asking him what his worries are if his foster care provider was spoken to. And would it be unreasonable to contact the foster care parents and bring it up to them first? And then we have maybe check in with his service coordinator.
Yes, we have lots of ideas in here. So I will provide a little bit of clarification in this situation. So this is an adult licensed foster care home for this scenario. We had some really, really great points in here, some of which I had on my list. So I think one important piece, similar to our first scenario, is are there potentially other vulnerable individuals in the home where there might be a safety concern? Let's see, some additional follow-up about questions about the safety. I think that that's a really important piece too. Simply asking, do you feel safe at home? If there are some concerns around that, like what would make you feel safer? The point about contacting the service coordinator, which would be the case manager through the community developmental disability program, um, is something I had a point on my list as well too, because that person can likely help to coordinate if there's any additional monitoring that might be needed at the adult foster care home. Somebody put a point of asking him what his worries are, or unreasonable to contact the foster care parents. So in terms of like the reasonability of it, here's some things that I'll point to, and maybe some of my co-panelists from Otis have some thoughts too. But when we're looking, so first of all, we have one injury that I don't know if any of you have slipped and fallen, but it would be pretty um, not super real. Like the likelihood that somebody would have a black eye as their sole injury from slipping and falling, and that being the impact, that doesn't really add up. That's not a consistent injury with the reported explanation. Um, and so the hesitation as well around contacting the support provider, that could also potentially be a red flag that something else might be going on there. Again, you have the information you have, but oftentimes contacting somebody who could potentially be an accused person when we're looking at abuse or neglect concern, we recommend not doing so. One, it could potentially put the individual at increased risk, potential retaliation as well. So I think it depends. The other thing I wanted to preface this is I like the school districts I've worked with, they all have different policies as well too. So it's really important. We don't know all of the exact like policies and procedures within like your organization. So it's going to be really important for you to reference those as well, and supervisors and all of that. Um, but another thing too as well is there's an injury there and there's an injury on the head too. So potentially assessing if medical care might be needed or inquiring about whether or not it was received for the injury. We talked about connecting with the case manager. There could be some safety planning as well that could be done. When asking about safety at home as well too, seeing if they have somebody in their life that they feel comfortable talking to, if they do ever feel unsafe. Just kind of assessing what supports do they have in their life already or that are established. Also, does the person have a history of unexplained injuries? This might depend on your familiarity with the person, so you may not have this information. But if you have been working with the person for a while and know more about them and their support needs, do they have a history of engaging in self-injurious behaviors? What does that look like? What types of injuries have resulted in the past, if any? And then similar to the first one, we like if our program was involved, we might want to coordinate with school staff to see if it would be possible to conduct an interview at the school with the student. And we would want to do so in as trauma-informed way as possible. So any of those insights you have into the person's needs, preferences is really, really helpful information for us when we want to try and coordinate a collaborative response to the concern. And there also might be a need to take photos of the injuries as well if the student consents. 1.2, just if possible, the sooner that we're made aware of the concern, the more likely we'll be able to respond same day and during school hours, if the same day contact is warranted depending on the situation. So if you are able to make the report earlier, like earlier in the day, if you have that information and you know it needs to be reported, that can really help improve the timeliness of our follow-up and response.
I want to make a quick point here. It's part of what interests me about this scenario is that when I'm looking at these facts, I think they could fall under either the child abuse, child and care statute or the adult abuse statute. And so I just want to clarify because earlier I said, well, if it's under the adult abuse statute, doesn't include school employees on the list of public or private officials. But since it can fall under both, and you are mandated to report under child abuse, any discretion that you might in practice have goes away because you have to report the child under the child abuse statute. So I just wanted to make that point before I go on to the next scenario. Scenario 3. Rocio, a 16-year-old student with a diagnosis of cerebral palsy, has been unusually anxious and is having uncharacteristic outbursts in class this week. They have limited verbal ability, but you can usually talk with them using a communication board. You ask them how they are doing. They get frustrated as they try to explain what's happening. They let you know that someone hurt them and they can't talk about it. What I want to focus on, for the sake of time and because it's what I'm most interested in with this scenario is, do you think there's reasonable cause to believe that Rocio has been harmed in a way that would trigger a mandatory report? What do you think? Or what would you want to know? Or if you focus on that question, is there reasonable cause to believe? What are you wondering about?
We have a question in the chat. Who hurt them? Definition of hurt. I'm wondering who hurt them and what kind of hurt. I would be wondering who and why they cannot talk about it.
I wonder about those things too. So when I think about putting first their frustration as they try to explain it and that they can't talk about it, why? Is it because their communication board has limited vocabulary and they can't use the board effectively to describe what's happened? Are they not equipped to discuss it in that moment because they're too upset and therefore just need some time to calm down or to, that their experience that the harm, did someone threaten them? If you tell, you're going to be hurt more, or I'm going to hurt someone or something else. Those are the sorts of questions I would have because there may or may not be reasonable cause to believe based on that. So I think I would want to know some more things. And then about this, someone hurt them, I agree. How was it that they said something that hurt their feelings, or yeah, is the hurt in their body, the hurt perfectly put? Yes, love those questions. That's exactly what I was wondering. And to at some point I'd want to know if it was accidental or intentional, like, but if it was a non-accidental injury, just thinking about the statute. What others have other questions about this? I just think it's important to I think to flag this reasonable cause to believe standard, which clearly I find value in repeating, is just to distinguish it from this idea of a suspicion, which I think reasonable cause to believe could be understood as a suspicion and maybe a definition of it, but it could also be this like, I just knew in my gut, like I didn't really, you need to be able to articulate a reason, I think, for it to be a reasonable cause to believe, not like, I think it's okay to feel something in your gut, but then I think you need to kind of ask yourself some follow-up questions about that, because we know bias comes into play in these situations for other reasons as well. With that, I turn things over to my co-panelist.
Yeah, I'll go ahead and kick us off. So one of the questions we'd asked in the initial survey was about how well folks knew about the investigative process or what happens when you make a report. So Krista and I are here just to talk a little bit about what that looks like and who we are as an agency. So just this idea about what is the Office of Training, Investigations, and Safety, and you'll again hear us refer to our organization as Otis. We are a shared service between the Oregon Department of Human Services and I guess that should say Oregon Health Authority, OHA. So we do investigations or oversee a number of investigations. We oversee investigations all across the state. So we're not limited to just certain county jurisdictions. We look at several different abuse types across the state of Oregon. We again, focus on those abuse investigations, whether it's investigations that Otis conducts or it's investigations that Otis oversees. We conduct training with county investigators. We collect data and report out on data. And we also have an appeals and licensing units that license the child caring agencies, the CCAs, and handle the due process when, say, an accused person has a substantiated finding of abuse against them. We have a due process that that individual can request to go through to have an administrative law judge make a decision about whether or not the state was able to prove their case and whether or not that finding stands or if it's overturned. So that's a little bit about what we do. The children's investigations are pretty vast in the sense that we don't do familial investigations of child abuse. So, like um, somebody in this child's home, a relative in the home, is potentially abusing this child, but our scope is really limited to investigations in licensed child caring agencies. In ODDS, licensed group foster and host homes, in the stabilization and crisis unit at the state level, educational settings, daycares, Oregon Youth Authority foster homes, and third-party abuse, which actually is probably the largest investigation area of our child abuse cases. So that's abuse that occurs, again, it's not somebody's family, but somebody outside of that individual's family structure, which is a lot of folks fall under that. Krista, anything that you would add before we move on?
No, I don't think so. I mean, other than Dallas said, we don't just do these children's investigations, but we also have a small team of investigators who also conducts investigations of abuse at other facilities, adults in ODDS license group homes, and the stabilization and crisis units for adults as well, and then in the Oregon State Hospital. So we do a vast majority or a variety, excuse me, of investigation.
Oh, and then we have a participant who has their hand up.
John again, I apologize, but you guys mentioned the stabilizing crisis units and foster care in ways of reporting and not to report and all that stuff. My question is, when service levels become distinguished, like SACU concepts and certain conversations to bring patients from one service level environment to another, how can we handle that within the trainings and the investigation? And then also with that, how does paid parents and minor children, are they looked at as familial familial type of language, or they looked as workers in ways of how we report other staff workers within a host home or foster care situation? Thank you.
Yeah, great. Thanks, John. Krista, do you want to field that?
Yeah, John, I'll try to cover all the parts of your question there. So if I miss anything, please let me know. But I think, a lot of people have the same concern as you, and they're not really sure who to report to. But I think just the best bet is to call the abuse hotline, and that hotline will direct you in which way it needs to go, whether that's with a family or with something that Otis investigates. Then what was that?
Continue on, please.
Okay.
Proper.
And so they'll help navigate because it's a really complex process, right? Like depending on who it is you're reporting about or who the victim might be or the person who's being looked at for the abuse. And the people at the hotline are really great at understanding the various laws that they have to follow. And so they'll either send it over to our Safe line for the adult screenings, or they'll send it to Otis, or they'll keep it within the child abuse hotline as well. So I don't think it's a matter of just worrying so much how that all gets transitioned about, but if you call the abuse hotline, then it will get to the right people.
To help me further understand, are you from the ODDS side, or are you from just the general hotline side? Office of Developmental Disability side, or that type of skill set, or are you more into the abuse hotline as a whole?
In my role?
Yes, please.
Yeah, so really I'm more on the abuse side of things. So
I understand
yeah.
response of where you're coming from. Thank you very much.
Yeah.
Those two types of situations are changing within the system. And I apologize again to the other people on the call while trying to navigate these kind of conversations and abuse investigation. Thank you.
No concerns, John.
Well,
It's a complicated system.
yeah. And John, if you're thinking that and you have that question, then I'm sure other folks on the call probably also have some questions very similar. So by you asking questions, it actually helps us answer some of the things that other people might be wondering about as well.
Yeah, including I'm going to go on the outside life when I take subsidized housing. When I used to, it's hard to know about who the homeless are and how to handle that culture to those with DD and IDD and other issues. So I appreciate again trying to weed out these questions and try to be as direct as possible.
Yeah, great. Let's see, Sam, do you want to advance the slide?
I would. Carol has the power.
Oh, great, Carol. Okay, thank you, Carol. So we'll talk a little bit about the screening process and how some of these calls that you might be making are screened and assigned. So screening for child abuse cases really begins at the centralized Oregon Child Abuse Hotline, so ORCA. If it's something that, again, is not the type of investigation that child welfare is going to conduct, like those family-based investigations, they actually they take some information and they transfer that to the Otis screening team. So all of those different kind of areas of child abuse that Otis responds to and is responsible for investigating, they actually get that information directly from ORCA. The screening team does daily staffings to review all these different types of cases that are coming in to determine if it is something that does meet the definition of abuse and if it is something that does need to be assigned for investigation. They have 3 days to make a decision. And so in that 3 days, they might be gathering some additional information, whether that's the behavior support plans or some of the individualized service plans, or to really make sure that they have an accurate picture about not just what happened, but about what kind of supports this individual requires. They, as part of that process, they cross-report to various agencies, whether that's schools, notification to the Oregon Department of Education if there's an allegation made against an education staff, the teaching standards. Help me out with this one, Krista.
It is the Teaching Standards and Practices Commission.
Thank you. And the district. And so again, we've got folks all around Oregon who conduct these investigations. So if it is something that meets that threshold for an abuse allegation and needs to be assigned for investigation, we have investigators all across the state. We've got 3 different teams of folks that conduct child abuse investigations. We have a couple of different response times. Krista, do you want to talk a little bit about the response times and some of the protective services?
Yeah, so the response times you see here, 24-hour, 72-hour, 10-day, that's really just based on the information that we're getting at the hotline. And our primary concern is always safety of the child. So if we're not sure if they'll be safe, then we want to get out there immediately in that 24-hour timeline. If we have information that maybe this incident that we're investigating involves a teacher and the teacher has been placed on leave, then we may be able to move that to a 72-hour contact because then we know they won't be having contact with the child. We don't implement protective services. That's kind of something that's a little bit unique about our office. For the children. So we would rely on the guardian or the policeman or the provider, the school, whoever that perpetrator is part of. Like I said, if it was a teacher, that person may be placed on leave. If it's a foster parent, then it might mean that the child is moved to a respite provider. But that's not something that we decide. We leave that up to the child's guardian and the program that they're part of. And then really that just means that the investigator is out there talking to that victim within that timeline or making contact with their guardian and trying to be planful of a good time to come and see that child so that we can do that in the best possible scenario. If that means they do better at school, then we'll come to school. If it's better at their home, then we'll come there. But we also really want to understand that child, that victim, and make sure that we're coming out there prepared if they communicate in different ways, that we're prepared to do that in a supportive way. We're ready for the next slide.
Yep.
Thanks. This just goes over our allegation types a little bit more in detail. I know Carol kind of hit some of these. She mentioned 419B. That just covers all children in Oregon, no matter what setting they're in. And then ORS 418 is like an extra set of statutes that further protects children who are in care. So meaning they're in DHS custody or they're in a program that meets the definition of a child in care agency. That can be an ODDS certified foster home or group home, mostly our residential and foster home settings. And so it's like an added layer of protection for them because they're even more vulnerable. Our investigations are incident-based. Our investigators are trained to conduct trauma-informed interviews, and we conduct interviews with a lot of people. It's not just the victim and the person who's being accused or what we call the respondent, but that would be a subject matter expert, someone who really knows this child, their abilities. If we're looking at maybe a wrongful restraint case where in a school, then we might talk to the trainer at the school, anybody who's a witness to that event. And we're trained to interview all of those people. We do a lot of things through our investigation. I know for Sam, she's going to be doing a lot of the same things during her investigation as well in collaborating. Just like Sam said, we're very collaborative. We try to work with people who are aware of the situation, who might know that child so that we can better communicate with them. But we're also going to work with other agencies. Sometimes that would be law enforcement. It might be a licensing entity, a provider, but really trying to work together to have the best possible investigation. We're also collecting evidence. That could be photos, video, support plans, incident reports, lots of training documents. So the more paperwork, the better. But we're really looking at all of those things to get a whole picture of what was happening. We at Otis, we do conduct recorded interviews when the person gives their consent for that. And that's really just to help us be more accurate in our process and make sure that we don't get any information wrong. It helps us to better participate in interviews as well, so that we're actually listening to what's going on. We're able to make eye contact with people. We're able to observe how they're responding to questions so we can be more trauma informed. So it is a really important part of our work. But we're also going to do that interview if someone says they don't want to be recorded. That's absolutely fine. We spend a lot of time typing reports and collecting all the information that we've gathered into one summary, and accurately reporting what evidence was found or not found. So the investigator will then make it what we call a dispositional finding, and that's really just to understand, did the abuse happen or not, based on those statutes that we referred to a little while ago. And those can take up to 60 days. We really try to make them go more quickly than that when possible. We can extend them longer. Usually that's because law enforcement's involved, though, and they've asked us to hold off on certain steps. And so we have to wait for them to be done before we move in. Or maybe we can't find somebody and we need that information from them as a witness, or, that person who's being accused of the abuse, that we want to give them the opportunity to respond. So what Otis is not, we've covered this a little bit. So in the essence of time, I will go quickly through it. But again, we're not the child's guardian. We can't act as child's guardian. That would be something that child welfare would be responsible for. We don't take protective custody, meaning we don't take children into our own custody. Again, that relies on the guardian. And if there's concerns for that, we go back to child welfare to deal with those family issues. We might work with a provider, again, with those protective services I mentioned, working with them to either have a kiddo move to another area, maybe have a different staff work with them, putting staff on leave. We don't actually provide services to people, and I think that is also something unique about our agency. And what that means is we might be able to tell you, hey, go check out this service over here, but we aren't able to actually implement that service for you or that child.
I think another component that is helpful to be thinking about in terms of the investigative process, especially as many of you are and have had experience of being the reporter, we are pretty limited in the information that we can provide the reporter. We may collect some additional information from you, but you may not be able to be notified about what happened at the end of this. And there's specific reasons around that. But I know that that's something that we've heard from lots of folks who make mandatory reports that can be disheartening and frustrating. But, there are some pieces that we do have to keep confidential, and there are some folks that we actually have to share that information with. And I think we talked about that a little bit with some of the folks that maybe need to do something with the information, such as licensing entities and some of those other case management entities that are delivering those direct services to individuals.
This slide also mentions what we do with our findings. If there was a founded finding, meaning we believe that there was reasonable cause to believe the abuse occurred, if someone disagrees with that, they can absolutely appeal that. They receive information directly from our office about that. And that's pretty typical over all the investigations that Otis either conducts or oversees at the county level as well. And then our office will help process through that. That's all done through the administrative law judge process. And those hearings are done by phone typically. They're very accommodating to the people who are involved. But that really is just to make sure that everyone gets their due process.
Okay, I think, are we up? Perfect. So for the sake of time, again, I'm gonna probably go quickly through these things. So I work for a community developmental disability program, also referred to as a CDDP, and we are a designee of the Office of Training Investigations and Safety, or OTIS, to conduct abuse investigations and coordinate protective services for adults who are eligible for developmental disability services in Oregon. So our investigation and screening process looks very similar to Otis's. We're just doing it for different folks. So we've got a 3-day timeline as well to gather that information and reach a screening decision of whether or not it meets criteria to open for investigation. Our program receives referrals from various sources. So we do have a main reporting hotline specific to our program. That's not going to be the same thing as the Safe Line or that main state reporting hotline, which I'd also like to emphasize too. It can be really confusing to try and determine who has investigative jurisdiction depending on the circumstances. And a really big part of our program workflow and process is to make sure that if it's not ours, that we're getting that information to the right place. So and from what I've heard too, that's a pretty common part of our process statewide with other CDDPs. So another important thing too as well is we do work closely with our intake and eligibility team within our specific program. When we have referrals for adults who've never maybe been found eligible but could potentially benefit, so that might be a part of protective service coordination or follow-up with the reporter. Similar to Otis, we don't take protective custody of the adults or really provide direct services. It really is collaborating and coordinating with others, such as the case manager who's involved, if there's a legal guardian established, service provider, family members, other natural supports, just to ensure that those appropriate protective services are offered. We do collaborate with other agencies as well, such as Otis, behavioral health, other community developmental disability programs throughout the state, child welfare, and licensing entities. And then Carol, you can switch the slide. Perfect. So we conduct investigations and death reviews for eligible adults living both in residential settings and the community. One thing about the CDDP investigations is we're county specific. So we're not doing investigations for folks who are receiving services in other counties or through other CDDPs in the state. And just an important thing that I want to say is every CDDP is different. So just know that it might vary if you're working with different counties. For example, I'm with Multnomah, and we have the highest number of referrals and the most investigations in the state, and we're the largest. So our process can look different from other smaller counties as well. And then for our investigations, similar to what Dallas and Krista were saying, we collaborate with other parties. We're gathering evidence, interviewing relevant parties in recorded interviews, and then documenting our findings in a comprehensive investigative report. And those findings will be a substantiated finding of abuse or neglect, unsubstantiated or not substantiated, or closed without abuse determination. Okay, how are we doing on time? I think
We have about 10 minutes left.
perfect. So our definitions of abuse, they do differ from the definitions for children. So when looking at ORS 430.735, and if you're curious and go look at the different elements of that specific abuse type, you can. Abandonment, physical abuse is going to look like any physical injury to an adult caused by other than accidental means or that appears at variance with the explanation given of the injury. So if we refer back to one of our previous scenarios with the black eye and the report of it being the result of a slip and fall, that would be an example of an observable injury that's inconsistent with the explanation given or there is no explanation. Willful infliction of pain, we've got different sub-definitions of sexual abuse, neglect, financial exploitation, involuntary seclusion, wrongful restraint, and then any death caused by other than accidental or natural means. But we do conduct death reviews even if there's not a concern of abuse or neglect for all adults who are enrolled in our services. And that is the brief overview that I wanted to provide about CDDPs. Again, I'm speaking from one specific CDDP, so just keep in mind if you're working with another program, their process might look slightly different, but Generally speaking, that emphasis on collaboration with the reporter and any other supports or relevant parties who are involved with the concern or the individual in their life, that we want to ultimately ensure that if we can gather information we need for the investigation and we can help coordinate protective services or safety plan to try and prevent further abuse from occurring, that we work together to try and do so as much as possible. Then I think I don't know who we had a bonus scenario. We've got 9 minutes, or if there's remaining.
We also did have some questions from our webinar last week. Rihanna, if you're able to share those.
May I answer the question in the chat
Oh,
or the
go
point in
ahead.
chat? And then I just wanted to not lose track of it. There's a comment, I thought if we have any question, we are supposed to report and let the investigators figure it out. And I wanted to respond to that, or start the response to that by saying, it's if you have reasonable cause to believe that harm has occurred, then you don't have to investigate anything. You just have to report that reasonable cause to believe. So that's the standard for that.
Yes, your job is not to figure out whether or not it for sure happened. That reasonable cause to believe it. What we've encountered and what sometimes we've had conversations with reporters too, who are trying to essentially conduct an investigation prior to getting to that reporting stage, it oftentimes far exceeds what would meet that reasonable cause to believe indicator. So Carol, I don't know if you have other thoughts on that, but that is oftentimes something that comes up where there's a concern of having to essentially have so much evidence to be like to determine that this absolutely happened prior to needing to make the report, when often that reasonable cause to believe requires far less.
Morgan, do you want to continue with these comments or go to the questions from the last session?
Sure. Let's see. We have the other comment. These are challenging scenarios, especially 2 and 3. These were from a while ago. We are looking at it from a mandatory reporting lens, but it could be bullying at school, the black eye, or a bad romance, being hurt. They are so challenging with the details we have. And then we have Rihanna posted the post-webinar survey in the chat. If you're able to take that for us, that would be wonderful. That's your feedback. Then we have a couple of other questions that you've had from earlier webinars. How do we support or ask questions to make the report without getting details? And best practices for supporting youth with IDD when disclosures happen, or connecting them with confidential advocates, especially when non-speaking. I know in the chat it says nonverbal, but usually non-speaking is the preferred term there. So any thoughts about any of those?
I can share a bit about asking some additional questions to make the report without kind of getting into you're now starting your own investigation. And a lot of times these reports are going to come up maybe in an existing conversation. Maybe you're already in a conversation with somebody and they allude to, and I think it's okay to say, hey, you mentioned this. Can you tell me more about what you mean by that? And when you said somebody hurt you, I saw some great questions in the chat about was it hurt your body or did they hurt your heart? And so having some more clarifying questions without actually asking, okay, so you said that this individual um, touched you in this way and it made you uncomfortable. Um, what time of day was it? Was there anybody around? Can you tell me exactly what was happening before? Has this ever happened? Did you report it before? And so kind of getting into some of those rapid fire versus just more on the tell me a bit more about what you mean by this. How do you define this term? What kind of, relationship is this person to you that you said did this thing? So getting some of those by asking some of those open-ended questions and then putting it back on that um, uh, alleged victim or the person that you're talking to really share, as well as I think somebody had mentioned a bit about sharing, some limitations to confidentiality and saying, I am a mandatory reporter. I do have to follow up on making a report if something is abuse. Um, so somebody had said, with that, is there more that you would like to tell me? Because I do have to make that report. And I know it can be really uncomfortable sometimes to tell somebody that you're going to be making an abuse report, but it is likely so much better to tell somebody that you are going to have to make a report versus having them be surprised when somebody reaches out about this investigation. And I've been in that position before where I've had to tell even colleagues things that they've shared with me that I have to make a report. But in terms of just being open and transparent about the limitations, I think it really goes a long way in making that individual trust you to come forward, even again, if something else happens to them. So those are just some of the things I wanted to weigh in on. And I'll turn it over to the other panel members.
I have nothing to add to your point.
I think there's an important comment in the chat too that is important to remember. You might hear the term false reporter thrown out there. So if somebody maybe has a history of inaccurately reporting, that's not reason enough not to report something. In fact, folks who often have that label attached to their records, their support plans can be at increased risk or more vulnerable because of that. So I think, Carol, you had said it earlier, it's great. It's like if you have this gut feeling, like checking in and see like, what do I have to back up with that? What have I observed? What have I heard? And that can be really important with somebody who might have inaccurate reporting as a risk or a support need. Is focusing on what you've observed and the not just the gut feeling, because bias really can come in no matter how experienced you are. And so just remembering that because somebody has a false reporting risk, that does not exclude the need to mandatorily report. And if you don't think that the report is accurate for X, Y, and Z, maybe you saw them in a totally different location at the reported time of the event, like that's really important information to share as well in your report because that can be very helpful during the screening process.
And just also, Samantha, just to piggyback off that is, that you talked about if somebody is in a different, location at the time that a report was made, your role as the investigator really is to just capture all of that information and put it together. So even when it's something that is, an inaccurate report, um, I think it's important to collect all the facts instead of perpetuating this stigma around false or inaccurate reporting. So making sure that you don't, kind of fall into perpetuating that by not believing an individual. So I know, Carol, you were going to weigh in as well.
Oh, I just wanted to quickly, I know we're near end of time, but there's a comment about best practices for supporting youth with IDD when disclosures happen or connecting them with confidential advocates, especially when nonverbal. I just wanted to suggest that as people from what victim advocacy programs are coming into the school to support you with training, otherwise, just get to know them and talk with them about how they would do this, because it's going to be on a case-by-case basis where you are in the state of Oregon, how all programs are supposed to be equipped to help, and I would think that some are better than others. And so for you to be comfortable with that, I invite you to get to know the programs in your community to know whether or not how good they would be at addressing this concern, which I really appreciate.
All right. Well, it looks like we're at the end of our time. We have final webinar poll here. And then the panelists, do you want to read off the results of the polls once they're ready?
Sure.
They should be all ready to go.
All right. So the first question, how confident do you feel that you know when to make a mandatory report? 55% of you felt very confident, 36% felt moderately confident, 9% felt slightly confident, and 0% felt not confident at all. For the second question, rate your understanding of what happens after you make a mandatory report of abuse, with 1 being very low understanding to a 5, which would be complete understanding. 55% of you rated it as a 5 with complete understanding. 36% of you rated it as a 4. 9% rated as a 3, and then 0% as a 2 or 1. So everyone felt a little bit more understanding than very low, which I think is good. Thank you all for participating in that.
All right. Well, with that, I think we're ready to wrap up. Thank you all so much. And we hope to see many of you next week at our final webinar in this series. And don't forget to take our survey if you haven't taken it already. Thank you.